right, it is a couple minutes after 2. I say we get going. All right, everybody, thank you for joining us here this morning, this Friday morning, for our Medicare Made Simple seminars. My name is Lori Smith. I am the training coordinator with Direction Home Area Agency on Aging. I also want to thank everybody here for moving with us into this virtual world. If you're familiar with these seminars, you know that we typically do them in person. But with COVID going on, we wanted to make sure that we were keeping everybody safe and healthy. So this is new to us. Thank you for helping us along this journey. I wanted to go over some Zoom controls if you're not familiar. So things you'll want to be aware of. I am going to have everybody muted by default, and that just helps keep background noises down to a minimum. I know we've been working from home since March. I've got kids here, and it can get distracting if you hear just the home noises going on, and we want to make sure that you're getting this information. So I will have everybody muted. If you would like to ask a question or give a comment, I will ask you to open up your chat box. And if you're using a computer, you should see a strip of menu options probably at the bottom of your screen. You may have to move your cursor to make them viewable. But you'll see something that says chat. The icon looks like a little thought bubble. If you click that chat feature, that chat icon, a window will open up on the side of your screen where you can type questions and comments. By default, those messages will be viewable to everybody here with us in this meeting. If you would like to send a message to someone in particular, you'll click where it says to everyone, and you'll see a list populate with everybody's name in here with us. You'll choose who you want to send that message to, and then only that person will see it. I won't see it, and Francine, our speaker today, will not see that either. But then if you want to send a question or a comment again to the entire group, you will need to choose everyone again. It doesn't go back that way by default. Some of us here are sharing our webcams, and I appreciate that. I'm to the point where I really miss people, so seeing faces is kind of good for my soul. You don't have to if you don't want to, but if you would like to, again, on that bottom strip of menu options, if you are joining us by a computer, you will see something that says either start or stop video. You can click where it says start video, and that will turn on your webcam. I will say, though, if you do choose to share your webcam, just be mindful of what's going on in the background. We'll also ask you if you need to move somewhere, don't pick up your device and carry it with you. That can also be kind of distracting as you see all the background moving around. And Francine is sharing her slides with us. If that portion of the screen is a little bit too small for your liking, you can adjust the size of that. So my screen is set up to where I see Francine's slides, and then I see a column of people, and then I have the chat window open. You might have people at the top, but what you'll want to do is put your cursor between the slides and then whatever panel is next to it, and your cursor will turn into a double-sided left-right arrow. And as you hold your left mouse button down, you can drag that panel left to right and make it sized to your liking. I do want to say that if you requested your supplemental materials by mail, those have been put in the mail. If you haven't gotten them yet, you will hopefully get them soon. I know the mail is a little bit slower this year than we are used to. I also sent out an email to everybody, regardless of how you requested those supplemental materials. So you should have those. If you don't have those hard copies yet, you should have received an email with those attached to it. If you didn't, let me know and I will get those out to you. But all those materials are also available on our website, and I'll review that once this session is done, how to get there. This session is being recorded, and we will have this posted to our website also. So if you would like to go back and review anything, you're able to do that. Or you know of somebody who is not able to get to one of these sessions, but would like to review this information, a link to watch this will be at our website. And again, once this is done today, I'll show everybody how to get there. With all that said, thank you again for being here, and I will turn it over to Francine. Thank you.
Thank you, Lori. Good morning, everybody. Please feel free to turn on your cameras. I love to see faces. It kind of helps me see if you have question that maybe shows on your face. So if you can, turn on your cameras. You will see there's, as Lori pointed out, there's something that looks like a video camera. And if you click on that, you can turn your camera off and on. So if you'd like to show your faces, please do so. So we're going to talk about Medicare today. I'm going to start off talking about people who maybe aren't on Medicare yet. So if you're not on Medicare yet, you have 7 months to enroll. You can enroll 3 months before your 65th birthday or up to 3 months after your 65th birthday. We recommend that you enroll prior to turning 65 so that your coverage can begin the first day of the month you turn 65. If you are already receiving a Social Security check when you turn 65, the government knows who you are, where you are, and how old you are, you will be automatically enrolled into Medicare, and you will receive a Medicare card in the mail. However, if you're not receiving a Social Security check, you need to enroll either by calling the Social Security Administration, or you can enroll online at www.medicare.gov. If you happen to miss this open enrollment period during your first time getting enrolled, you can wait until January, and you can enroll between January and March of each year. However, your coverage will not begin until July, which is why we like to say that it's better for you to enroll early. Those who are under 65 and who have been disabled under Social Security Administration rules can qualify to get Medicare after waiting 24 months. There are also special enrollment times. So if you have been out of the country or out of your state, you get a special enrollment period. So if you're out of the country and you move back to the United States, you can enroll and you can change your Medicare coverage. If you move in and out of a skilled nursing home, you can change your Medicare coverage. And if you're covered by a primary employer, or you're covered by your employer and your Medicare is primary, your employer's coverage is primary to Medicare, you can enroll once you lose that coverage through your employer. And I'll talk about that again as we go on. If you're already on Medicare, which I know many of you attending today are, this is your open enrollment time, and this is a time when you can check your coverage and decide if you want to stay with the coverage you have or change it. If you have a Medicare Advantage plan, and those are plans like SummaCare or Anthem, you should have received what's called an annual notice of change. That should have come out by the end of September. They used to mail those out to everyone, but it could be online. So you want to make sure that you look at that and see how whatever plan you have has changed for 2021. If you decide to change the type of Medicare coverage you have or change your Medicare Advantage plan, you can do that now until December 7th. And this includes all Medicare beneficiaries, even those who have both Medicare and Medicaid. So if you're a person who's on MyCare Ohio, please be aware that you also have the right to change your Medicare coverage at this time. When I talk about Medicare, people often say that they feel very confused by it. But really, when you think about Medicare, there's only two choices of coverage. You can choose to have your Medicare coverage through a Medicare Advantage plan, or you can choose to have your coverage through what we call traditional Medicare. There are differences. With a Medicare Advantage plan, you must have Part B. These are private plans, but they're Medicare plans. They are not supplemental plans. Supplemental plans are something different that we'll talk about as we go on this morning. Most Medicare Advantage plans include drug coverage. So you get your Part A, your Part B, and your Part D, your drug coverage, all wrapped up into one, and you only use one card. All Medicare Advantage plans have to cover the same things that traditional Medicare covers, but they are allowed to include extra benefits. And those extra benefits can be dental coverage, it might be vision coverage, it can be fitness coverage. So there are extra benefits. In addition, and this is a big thing for people who have high medical costs, Medicare Advantage plans have out-of-pocket limits. That means once the amount you spend out of pocket for your medical care reaches a certain amount, the plan will cover you in full. There are geographic restrictions with Medicare Advantage plans, so the plans are different for every county, which is why we have different charts for every county that we cover here at Direction Home. So there are different Medicare Advantage plans for Summit, Portage, Stark, and Wayne counties. In addition, most Medicare Advantage plans have provider restrictions. So you typically have to use their doctors, their hospitals, and all their other types of providers. Now with traditional Medicare, you don't have the extra benefits that you can get with Medicare Advantage plans. Also, there are no out-of-pocket limits like there are with Medicare Advantage plans. You can, however, add a supplemental plan to cover your out-of-pocket costs with traditional Medicare. And I'll talk about those a little later too. In addition to that, you would have to add what we call a standalone Part D plan. So you have to have separate drug coverage. A good thing about traditional Medicare plans is there are no geographic restrictions. You can go anywhere in the United States to any facility as long as that facility or doctor takes Medicare. There's no gatekeeper. And by that, I mean, you don't have to go through prior authorizations, which some Medicare Advantage plans do require you to go through prior authorizations to get services. There's an open provider network, as I mentioned. So again, anybody that takes traditional Medicare, you can go to if you have traditional Medicare. And some people feel that that's important. So those are the two choices for coverage. And those are the differences between the two choices. The choice is yours. With the Medicare Advantage plans, you'll see when we review those, some have premiums, some do not. Again, you have to have Part B to join a Medicare Advantage plan. Most of them do include prescription drug coverage. And please know that you cannot buy supplemental coverage when you join a Medicare Advantage plan. It's illegal for you to have supplemental coverage and a Medicare Advantage plan. With original Medicare, we'll talk about the premiums. Typically, there's no premium for Part A. We all going to pay a premium for Part B. You're going to have to add prescription drug coverage, but you can purchase supplemental insurance to cover your out-of-pocket costs. So I'm going to talk about traditional Medicare and the costs under traditional Medicare. As I mentioned, typically there's no premium. The reason for that is, as long as you or your spouse worked for 10 years full-time, you've already paid into the Medicare system. So you've already paid for that Medicare Part A. Medicare Part A includes your hospital insurance. When you go into the hospital, however, you have a deductible. And these numbers are from this year. The government has not released the numbers for 2021 yet. And I'm kind of surprised because typically they are released during the first week of November. So I'm a little worried that they're holding off for some reason that we don't want to know, like maybe they're going to increase a lot, but I'm hoping that's not the case. So under traditional Medicare, you have a deductible for $1,408, and that deductible will hold you for 60 days. If you're in the hospital longer than 60 days, and you're in there for day 61 up to 90 days, you would have a daily copay that you would pay of $352 this year. Then, if you're in the hospital longer than 90 days, which is very, very rare, you have what is called lifetime reserve days. And those you can only use once. You will have coverage for days 91 through 150. but you would pay a daily rate of $704 per day. As I said, that is very rare. Original Medicare Part A also covers skilled nursing home care. Now, when I say skilled nursing home care, I'm talking about physical therapy, occupational therapy, speech therapy, or if you're so medically complex that you need an RN to monitor your care daily, that is what defines skilled care. It does not cover custodial care. Custodial care is when someone goes into the nursing home because they need help with dressing or they need help eating. That's not covered by Medicare. With traditional Medicare, typically, except for this year due to COVID, you would have to have a 3-day hospital stay. And that does not include the day of discharge. But if someone is currently hospitalized because they have COVID, that 3-day hospital stay is waived. Also, please know that if you're in the hospital and you are under observation status, that would not count as a 3-day, those days do not count as a 3-day hospital stay. And there are no appeal rights for that. So that's an issue that has arisen for many people. So you want to make sure that you ask when you enter the hospital, have I been admitted? Am I under observation status? They're actually supposed to tell you within 2 days whether you are admitted or you are under observation status. So if you go into a skilled nursing facility for, let's say, rehab, which is why most people go, you are covered in full under traditional Medicare for days 1 through 20, so for 20 days. If you are receiving skilled services past 20 days, you are covered up to 100 days, but you would pay a copay of $176 per day. Now, I will say that it's very rare if anyone can remain skilled for 100 days. Typically, rehab is stopped usually around day 20. That doesn't mean it has to be stopped, and there are appeal rights if it is stopped. But typically, it's very rare for someone to be skilled for 100 days. So the benefit only lasts for 100 days. Then you would need to not be receiving skilled care in a nursing home or a hospital for 60 days before a new benefit period can begin. Again, this has been waived due to COVID, but it's going to be up to the skilled nursing facility as to whether they will waive this. So that is going to depend that's going to be based on the decision of the skilled nursing facility. Part A also covers hospice care. Hospice care is comfort care. It's what you can get hospice if you're not receiving curative treatment. Hospice covers pain relief and symptom management. It also covers drugs and durable medical equipment for pain relief and pain management. Your drug copays are going to be low when you're on hospice, no more than $5. It also covers aid and homemaker services, spiritual and grief counseling. But if you're in a nursing home and you're receiving hospice, hospice will cover all these services, but it will not cover your room and board. And also, if you enter a skilled nursing facility for respite care, and that's when a person might be at home receiving hospice and the family needs to maybe go away for a while or needs a break from care, so the person goes in short term into a skilled nursing facility, you would have a 5% copay for that respite care. So that's Medicare Part A. Now I'm going to talk to you about Medicare Part B. With Medicare Part B, we all pay a premium, and the amount of premium you pay really depends on when you entered Medicare. So those of you out there may be paying different amounts for your Medicare Part B premium. The premium in 2020 is $144.60 a month. Again, the government has not released the new amount for 2021, but it is estimated to be $148 per month. And that is due to legislation that was passed by Congress, because what they saw was an increase in the Part B premium could go as high as $153.30 a month for next year because of the increase in the amount of people that were using Part B services this year because of COVID. So they passed legislation, and they're estimating now that the new number will be $148 a month. In addition to a monthly premium, you pay a yearly deductible under Part B. And in 2020, this year, that amount was $198 per year. Again, I don't have the figure for 2021 yet. On top of that, for Part B services, you pay 20% of the Medicare approved amount. This amount is generally waived for most preventive services, because with Part B covers things like your shots, your exams, your doctor office visits, your screenings, some diabetic supplies. So for preventive services, the 20% is waived. For other services, it is not waived. Part B is also income adjusted. So if you're single and you make more than $87,000 per year, or you're married and you make more than $174,000 a year, you will pay more for your Part B premium. Cost of living adjustment. We do know that the cost of living for those that are receiving Social Security has increased by 1.3%, which will be an average of $20 per month. So those of you receiving Social Security should get a raise of about $20 a month on average, and that will be enough to pay for the increase in the Part B premium, which is estimated to be $148 a month. So everyone will see that increase in the Part B premium. If the amount of your raise would not be enough to pay for an increase in the Part B premium, you would be held harmless, meaning that you would stay at the rate you currently are. But the way things look right now, everybody's going to be paying that $148 per month. Some of you out there can delay your Part B enrollment. So if you or your spouse is currently working, so you have to be currently employed, and you have insurance through your current employer that is primary to Medicare, and usually it is primary to Medicare if there are more than 20 employees, then you can delay your Part B because you already have insurance. So you wouldn't want to have to pay that Part B premium. But to do that, you have to inform the Social Security Administration and let them know you want to delay your Part B. You can do that by phone. You can do that by going online. They do have, I'm told they do have a form that you can fill out and do that online that will inform them that you want to delay. If you have, let's say you lost your employer's insurance, but you are covered by COBRA for a while. Even though you may be covered for COBRA longer than 8 months, you must enroll in Part B within 8 months of getting COBRA. Do not wait until your coverage ends, because if you do not enroll in Part B when you are eligible to enroll, you will pay a late enrollment penalty, which is 10% of the premium of each month you were eligible and you did not enroll. And these are lifetime penalties. So you want to make sure that you're not paying a penalty and you enroll at the appropriate time. So as you can see with Medicare Part A and Part B, if you choose traditional Medicare, you have some out-of-pocket costs. So to cover those out-of-pocket costs, you can choose to buy what we call Medigap or supplemental insurance. These are standardized private plans that cover your out-of-pocket costs with traditional Medicare only. They only work with traditional Medicare. You cannot have a supplement and have a Medicare Advantage plan. Now, in your packet, if you received a packet, you should have a chart that shows you the the supplemental plans you can choose, and the coverages under each supplemental plan. The monthly premiums for these plans will vary depending on the coverage. For this year, people who are new to Medicare, who did not enroll, in other words, you did not enroll in any part of Medicare, either Part A or B last year, you can no longer purchase what used to be Plan C, F, or the high deductible F. For those of you who may have enrolled, let's say you delayed your Part B last year because you're still working, so you went ahead and you enrolled in Part A, and you want to go on Medicare this year, you are grandfathered in so that you can purchase these 3 plans, the C, F, and the F high deductible. So, as I said, anyone enrolled in Medicare before January 1st of 2020 can still purchase these plans. What you also need to know about these plans is they only work for things that are covered by traditional Medicare. Traditional Medicare does not cover prescriptions unless you have a Part D plan. It does not cover long-term care. It does not cover things like dental or vision. So all those extra services, none of these supplemental plans will give you coverage for these things. There are some guaranteed issuance rights. So the best time to choose a supplemental plan is within the first 6 months you are 65 and have Medicare Part B. The reason for that is during that time, an insurance company cannot ask you about your health. They cannot deny you if you have pre-existing conditions, and they cannot underwrite you, meaning they can't charge you more for that insurance during that time period. Also, if you decide when you first enroll into Medicare that you don't want traditional Medicare, let's say you decide you want a Medicare Advantage plan, but during the first 12 months of your enrollment into Medicare, you decide that you don't like your Medicare Advantage plan, you can purchase a supplemental plan. So, and they have to allow you to purchase a supplemental plan, but you've got to do that before those first 12 months are up. There are what we call Medicare savings plans to help people with lower incomes with their Medicare costs. There are typically 3 of these Medicare savings plans. There's a qualified Medicare beneficiary plan, or QMB, and this will pay for a person's Part B premiums and all their deductibles and copays. And these are numbers from 2020. They probably won't change until March of 2021. So this tells you what your income, what the income limits and resource limits are. And by resource limits, I'm talking about money in the bank, stocks, bonds. There's also SLMB, Specified Low Income Medicare Beneficiary. And in that program, it doesn't pay for your deductibles and copays, but it does pay your Part B premium. Your income can be a little higher than it is for QMB. And then we also have the QI program. That will pay your Part B premium, but typically each year they only allow so many people to qualify for QI. And again, you can see that your income can be a little higher for this program, whether you're single or married. To apply for these programs, they're administered through your county Job and Family Services, and you should contact them to apply, or you can call Direction Home and ask for our Aging Resource Center, and they will help you apply for these programs. Okay, I'm going to stop there before I talk about prescription drug coverage and see if there are any questions about traditional Medicare Part A and B.
Francine, so far we've just got one in the chat box. It says, do most Plan F supplementals cover both Part A and B out-of-pocket costs?
Plan F covers all out-of-pocket costs. It's the most comprehensive plan you can get.
Good. And if anybody else has any questions, just drop them in that chat box for us, and I will read them out to Francine as we go.
Okay. So now we talked about Parts A and B. Now we're going to talk about Part D, your drug insurance. So every year there's a standard benefit that comes out. Now these numbers are for 2021. These numbers were released. So what the standard benefit is, what it means is that any insurance company who wants to offer drug insurance has to have a minimum of these benefits. So they can have a deductible, but the deductible cannot be more than $445. So that would mean that you would pay the first $445 of all your prescriptions before coverage would kick in. The initial coverage limit went up a little bit for 2021. Now this is the amount that your insurance company pays for your drugs, and in addition to the amount that you pay for your drugs. So you add those together, and once they reach $4,130, you would enter the coverage gap. And yes, I know everybody thought the donut hole, the coverage gap, was going away, and it has been reduced significantly due to the Affordable Care Act. So what has happened over the last several years is that every year the amount you pay in the coverage gap has gone down. Now it is to the point where if you enter this gap, you would pay 25% of your copay, or 25%, your copay would be 25% of the cost of your medications. Once you have paid out of pocket and your out-of-pocket costs reach $6,550, you come out of that coverage gap and catastrophic insurance kicks in. And at that point, you're paying 5% of the total cost of your drugs, or $3.70 for generics and $9.20 for brand name drugs. So that is the standard benefit for 2021. In choosing prescription drug coverage, if you don't have prescription drug coverage through a current employer or a retirement plan that is the same or better than Medicare, you would have to choose a Part D plan. If you do have prescription drug coverage through a previous employer or a current employer, and it's better than, same as or better than Medicare, you do not have to choose a Medicare Part D plan. Also, if you have coverage for your medications through the Veterans Administration, you do not have to choose a Part D plan, but you can have both VA coverage and Part D. And typically you wouldn't want to do that unless there's a drug that the VA is not covering, which you know will be covered by Part D. So there are two choices to get your prescription drug coverage. If you choose a Medicare Advantage plan, most of those plans include Part D coverage. There are a handful who do not, and when we get to those charts, I'll talk about that. So if you chose a Medicare Advantage plan that did not include drug coverage, you would have to select what we call a standalone Part D plan. So if you got your packet, you can look in your packet, and I believe the chart you have in there has a green banner at the top. You can look at that chart, and that will tell you which the names of the plans that are standalone plans. So you would choose a standalone plan if you chose traditional Medicare, or if you chose a Medicare Advantage plan that doesn't cover drugs. Now, people always ask me, do I have to get Part D if I don't take any prescriptions? And my advice to you is that yes, you should get Part D even if you're not taking any prescriptions. Because the first thing you have to know is, if you don't take Part D and you get sick in the middle of the year, you cannot pick up a prescription drug plan. until open enrollment, which is now, from October 15th through December 7th, and your coverage, you wouldn't be covered until January 1st. So you would be paying out of pocket. And if you had a severe illness with high prescription costs, those would all be coming out of your pocket. So you don't want to take that chance. Just like you don't want to wait until your house burns down to get homeowners insurance, or you don't want to wait until you're in a car accident to get car insurance. It's the same train of thought. Also, if you don't choose Part D plan when you're first eligible, you will again pay a lifetime penalty, which will be 1% of the average national premium for each month you did not enroll and were eligible. So please, that's why we say, yes, you should choose a Part D unless you have what we call creditable coverage through your employer or retirement plan. In choosing Part D, I always suggest that people conduct an analysis every year, that because the drugs that these insurance companies cover, whether it's a Medicare Advantage plan or a standalone plan, their formularies change every year and the amount they're going to charge you is going to change every year. So you want to make sure that you're choosing a plan that's most cost effective for you. To conduct your yearly analysis, you can do it yourself or have a family member do it for you by going to www.medicare.gov. And what you do there is you enter your prescriptions, you enter your dosages, and then the computer will do the work for you. And it will show you the most cost-effective plans for you. And then you can compare those plans. And you can compare up to 3 plans at one time to decide which one you would think you might think is better for you. If you're not a person who wants to go through all of that, you can call the Ohio Senior Health Insurance Information Program. And their number is 1-800-686-1578. The Ohio Senior Health Insurance Information Program has trained Medicare counselors. The program is located in the Ohio Department of Insurance, and those individuals will do the analyses for you and help you select not only your Part D plan, but your coverage. You can also call 1-800-MEDICARE, and they can assist you in choosing a plan. So just like with traditional Medicare, Medicare Parts A and B, there are also programs that can help people with lower incomes. These are called the extra help programs or the low income subsidy. There's a full subsidy and then there's a partial subsidy. For the full subsidy, and again, these are numbers for 2020. They probably won't change until maybe March of next year. If you're single and your income is below that $19,140 and your resources are below $14,610, you can qualify to get a prescription drug plan for free as long as the premium is not higher than $29.83. And then if you're married and your income is below that $25,860 and resources below $29,160, you can qualify again to get a prescription drug plan for free as long as the premium for that plan is below $29.83. And you'll pay very low amounts for your prescriptions if you qualify for these plans. There's also, a partial low-income subsidy. I didn't put those numbers up. You can contact, this program is administered through the Social Security Administration. If you go to their website, which I have on the slide, www.socialsecurity.gov, or call them, they can help you enroll and see if you qualify for this help. You can also call Direction Home, and Direction Home will help you fill out the application for this subsidy. We go right online. We'll ask you a lot of questions. You're going to need to have your income information ready, and we can apply for you to see if you qualify for this coverage. If you qualify for the full low income subsidy, or you have both Medicare and Medicaid, again, if you choose a plan that has a premium below this benchmark of $29.83, you don't have to pay a premium. If, however, you choose a plan that has a premium that is more than that $29.83, you will pay the difference between the plan premium and the $29.83. Any questions on Medicare Part D?
So I've got a few questions here.
Okay.
The first one is, I enrolled in Part A in September of 2020, and am I correct that I will not be eligible to enroll in Medigap or supplemental plan when I retire in December 2021?
You are eligible. You are eligible to enroll in a Medigap plan. You have your guaranteed issuance rights because you'll be 65 and you'll be enrolling in Part B also. In addition to that, because you enrolled in Part A, you will be eligible to get those other plans.
The next question is, I have OPERS and some Social Security, need to know what I need.
Generally, if somebody has OPERS, your coverage under OPERS is going to be better than the coverage that I'm talking about here, either under traditional Medicare or a Medicare Advantage plan.
Okay, and someone says, I'm on the Medicare site. Can you direct us to the section or specific link that will do the Part D comparison? I think I've got the page that does that specifically dropped into the chat box. But as Francine keeps presenting, I will dig around further. And if I find something more specific than that link that I just dropped in, I will put that in the chat box as well. Or Francine, if you know that off the top of your head.
Well, if you go to Medicare.gov, the page is going to come up, and I believe the page says find plans or find plans for 2021. If you click on that, that should take you right to the analysis.
Okay, good. That's the link I dropped in there. Perfect.
Yeah.
And then I just got a new job and applied for copay that company's benefits. Will I have to get Part D?
If your company's benefits, your prescription drug benefit is the same as or better than Medicare, you do not have to get Part D, but you will have to ask the HR person there. And they should be able to provide you with a letter that says, yes, you have creditable coverage.
Okay, that's all we have so far.
Okay. All right, so we talked about two choices for coverage. I talked about traditional Medicare. Now I'm going to talk about the second choice for your coverage, and that's Medicare Advantage plans. As I mentioned, to get a Medicare Advantage plan, you have to have Part B. I also mentioned that under traditional Medicare, outside of this COVID situation, to get coverage for therapies in a skilled nursing facility, you would need to have a 3-day hospital stay. Most Medicare Advantage plans do not require a 3-day hospital stay for you to get coverage for skilled care in a nursing home. Most of these plans do include drug coverage. A few do not. So if you take out, in your packet, if you received it, if you take out that very colorful chart, you will see a list of all the Medicare Advantage plans. But on the last page of that chart is a list of the Medicare Advantage plans that do not cover prescriptions. So we separated those out for you. And with those, you would have to choose a Part D plan. But as you'll see, most all of them do include drug coverage. You will also see that they all have out-of-pocket maximums. Now that is important for people who have high medical costs. It's important for everyone, but if you're a person that has high medical costs, you really want to look to a plan that has a low out-of-pocket maximum. And those out-of-pocket maximums would be on the far right-hand side of the chart. We also have listed on those charts the premium amounts, and you will see that many of the plans have 0 premiums. Some plans have premiums that can be over $100. Generally, if that's the case, you're getting some better coverage and maybe some extra benefits. Usually, you're going to have extra benefits, maybe some full dental coverage or full vision coverage. So you want to check that out too. There are provider limitations with these plans. So if you see next to the name of the plan, it says HMO. That means Health Maintenance Organization. And that means that you have to use that plan's doctors and hospitals and other providers. If you see next to the plan where it says POS, that means point of service. And that means you may be permitted to go out of network if your primary care physician refers you to do that. If it says PPO, that's Preferred Provider Organization. That means that you may have some ability to go out of network, but you need to check with the plan because they may charge you more for going out of network. So that's what those initials stand for, and that's why there's differences in whether or not you can go in or out of network. And for some people that's important, so you want to pay attention to that. You should also pay attention to the star ratings, which are listed. The highest star rating is 5, the lowest would be 1. We don't have any 5-star plans in our region in any of the 4 counties, but we do have some 4.5 plans that are rated 4.5 for their overall star ratings. And you should never choose a plan, in my opinion, if the overall star rating is less than 3.0. And I don't think we have any this time, if I recall. I think the lowest star rating we have is probably 3. Also, with these plans, and I forgot to mention, some of them might show that there's a medical deductible, a health plan deductible, and what that says is you would have to pay that amount before your medical coverage would kick in. And there are a few of those on that chart. So you want to look at that too. All of these plans this year have some type of fitness benefit. That benefit has become so popular, they all have some type of fitness benefit, but again, that's going to vary by plan. They all cover telehealth. Some of the plans might give you money to purchase over-the-counter drugs or other over-the-counter supplies that you might find in a drugstore. Some of the plans cover dental, hearing, and vision. Actually, I think all of them do this year, except that the amount of coverage for these services is going to vary by plan. Typically, the higher premium plans are going to have more coverage for the dental, hearing, and vision. Also, some plans will allow you to purchase extra coverage for those benefits. So you would pay their premium if they have one, and you'd have a separate premium to pay if you wanted a more comprehensive coverage for dental, hearing, and vision. And then all the plans this year do offer opiate recovery and treatment programs. There are also 2 plans that are called Medicare Savings Plans, and they are offered by a company called Lasso. These are high deductible insurance plans that you can buy. They only cover your medical costs once you reach the deductible. What they do is they set up a medical savings account for you, and they deposit money into an account yearly, which you use to pay your healthcare costs. So you meet the deductible, then you have money to spend on your healthcare costs. Only Part A and B services are covered and count towards your deductible. So if you receive a medical service that is not covered by Part A and B, it does not count towards your deductible. You cannot be charged when you go to the doctor or hospital or whatever. You cannot be charged ever more than the Medicare approved amount. And that's a good thing. So they're not going to charge you like what they would charge somebody who didn't have any insurance. They're only going to charge you, they can't charge you more than the Medicare approved amount. As I mentioned, the plan covers all costs after you reach your deductible. And if you have money left in your account at the end of each year, you can just keep carrying that over. So there are some people who like these types of plans. And if you're interested, you should contact a broker to talk more about that. We also have, and not included in your packet, because these don't relate to everybody and they can be very confusing. We have what are called special needs Medicare plans. And these are plans that cover people who have both Medicare and Medicaid. They're also specific to those individuals. They can be specific to people with chronic conditions like heart disease or diabetes. And they can also be specific to people living in nursing homes. So with these, I would say that many do have premiums. Even if you are on both Medicare and Medicaid, you might have to pay a premium for these plans. Some have medical and drug deductibles. The benefits vary and should be compared very closely to other plans, especially if you are a person who has Medicare and Medicaid, and somebody wants to sell you a special needs plan. You want to look at the benefits very closely because they will differ from some of the benefits that are covered by the MyCare Ohio plans or Medicaid. So you want to be very careful when you switch to those plans. I mentioned MyCare Ohio. For those of you that are not familiar with MyCare Ohio is a demonstration program that began in Ohio in 2014. It is for people who have both Medicare and Medicaid. And those individuals that have both have to choose either CareSource or United, in our region anyhow, to be their Medicaid plan. They can also choose to have CareSource and United cover them for both Medicaid and Medicare. But if they choose not to do that, they can opt out. So you still, if you're on MyCare Ohio, you don't have to choose CareSource and United to cover you for both Medicare and Medicaid. You have to choose one for Medicaid. You still have the right to choose any Medicare option that's available to other beneficiaries. However, if you do decide to opt in, meaning that you say, yeah, I want one of these plans to cover both my Medicare and Medicaid, you can get some extra benefits. So in one of these plans, you have no copays for your prescriptions if you opt in. In another one of these plans, you get $200 or more a year to spend on incidentals in the pharmacy. So there are extra benefits that can apply. Also, you might get some extra benefits in regards to getting transportation to medical appointments. So you might get more trips if you opt in. So you want to look at the coverages and the extra benefits before you choose your plan. Okay, before I go on, I'll stop there. Any questions?
Yes, got one more. This is from a care manager on behalf of their member. If I have turned 65 in October and my Care Medicare card shows effective November 1st, 20, and I also have a Medicaid waiver, how long will it take to get the MyCare enrollment letter?
Usually you get it within 60 days of having both.
Okay. And that's the only new one so far.
Okay. So we had a big increase in plans in Summit County, Stark County, and Portage County this year. So in Summit County, we have 77 Medicare Advantage plans. You'll note that the last page of those charts will show you that there are 8 plans that do not cover prescriptions. In Stark County, we have 66, 7 without drug coverage. In Portage County, we have 64, 6 without drug coverage. And in Wayne County, there are 49 plans to choose from, 5 without drug coverage. So each year when I do these charts, I look at what changes I see. Premiums have remained relatively stable this year over last year. I did see some increases in out-of-pocket maximums, meaning that some of these plans increase their out-of-pocket maximum by quite a bit. So again, if you have high medical costs, you want to look at those out-of-pocket maximums because they can be as low as about $3,400 a year and as high as $10,000 a year. So there are big differences there. Most of the plans have very low copays or no copays when you go to see your primary care physician because they want you to go to the doctor and get your preventive services each year. There are 2 new companies. So with the new companies, there are no star ratings because they haven't been around long enough. And those companies include Bright Advantage and Devoted Health. When you're considering a Medicare Advantage plan, you want to consider cost. So you want to focus on the services you use most. So if you know that you're going to go to the hospital this year and you're going to have maybe a knee replacement, and then you're going to go for therapy in a skilled nursing home, you want to look at what those costs are going to be. You also want to look at your drug coverage and what you're going to pay for your prescriptions. You want to make sure all your drugs are included in the plan's formulary. You want to make sure the doctors and hospitals that you want to go to are in their network. And if you're interested in extra benefits, you want to look at those. You'll notice that with some companies, Anthem comes to mind right off the top of my head, they have several different plans. Now, the differences between these plans can be very, very subtle. So again, I encourage you to do those analyses because it can get very confusing if you don't. Again, I want you to look at those star ratings and also consider the plan's reputation. So if you're thinking about trying a new plan, changing your plan, you might want to talk to your doctor's office and say, how easy do you take this plan, number one? And if you do, how easy are they to work with? They'll be able to tell you and give you information. Do not choose a plan based on what your friends and your neighbors are telling you, because these plans you need to consider your own individual circumstances and the costs you will incur and your prescription costs before you choose a plan. So again, I encourage you to have an analysis done. You can go to, again, Medicare.gov website. You can call OSHIP, the Ohio Senior Health Insurance Information Program. You can call Medicare, and they will help you to select a plan. We want you to choose wisely. You can only switch plans during certain times of the year. So for those people that don't have Medicaid, this is your chance to switch plans. Do it now before December 7th. You can also, if you choose a Medicare Advantage plan, and then you think, oh, I think I made a mistake, I shouldn't have done that, you can switch between January and March of each year. So you can switch back to traditional Medicare. If you have both Medicare and Medicaid, you used to be able to switch your coverage every month. You can't do that anymore. You can only switch once per quarter in the first 3 quarters of the year. And then again, of course, now during open enrollment. Any questions? Okay.
Yes, so we got one. Can you change plans only once from Advantage Plan versus Medigap?
Well, let me put it this way. If you drop your Medigap plan, they're very difficult to get back. So I don't recommend typically that people drop their Medigap plans, because if you're outside of that 12-month period when you're first newly enrolled into Medicare, those companies do not have to cover you if you have pre-existing conditions, and they can underwrite you. Now, if you choose a supplemental plan, and let's say Medicare Advantage always has to take you because it's Medicare. So there are no restrictions on when you can join a Medicare Advantage plan.
Okay. And then they've got a little follow-up while we're on that. And then there's a fee or penalty if you switch.
There's no, Medicare Advantage is Medicare. There's no penalty if you switch.
Okay. There's a question. I live in Tuscarawas County, and I'm wondering if I can choose a plan in Summit County if I use only PCP and hospitals in Summit County.
No, you cannot. You have to, there are geographic restrictions for Medicare Advantage. You have to use one that's specific to Tuscarawas County.
Okay. And do you feel that most people choose traditional Medicare versus Advantage plans?
Most people are choosing traditional Medicare. However, the number of people now choosing Medicare Advantage plans is climbing every year. So I think the last number I saw was over 30% in our regions choose Medicare Advantage.
Okay, and that's all we have right now.
Okay, so we'll finish by talking about what's new with Medicare. There is a new 2-year demonstration program. It's called the Senior Savings Model for Prescription Drugs. And so some Medicare Advantage plans that offer drug coverage and some standalone prescription drug coverage, it can choose to enter this program, and it's for people who need insulin. And you would only pay $35 for your insulin. Now, when we did our charts for the plans, that information was not on the Medicare website at that time. But if you do an analysis on your prescriptions and you are taking insulin, it will show up. So if you see that $35 copay, that's a good thing if you're on insulin, because as you know, it can cost a lot more than that. So this is a program. They're trying to see if it works and if it helps people, and if the insurance companies are able to do this and still make money. So I would encourage anybody with diabetes to look into that. Also, before this year, people with end-stage renal disease were not permitted to join Medicare Advantage plans. They are now permitted to join a Medicare Advantage plan. There also, as I mentioned, used to be that you would sign up for Part B by going to the Social Security Administration. There are now online applications to enroll into Part B on the Social Security website, especially if you have delayed your Part B, because the Social Security offices are closed except if they deem you to have dire circumstances. And by dire circumstances, they mean you need your money for housing, for food, those types of things. So unfortunately, they're not going to allow everybody to come into the offices, and you will have to use some of these online applications. Changes related to COVID-19. Those who are tested for COVID-19 do not pay a Part B deductible or copay, so the test is free. Medicare Advantage plans can waive and reduce cost sharing for any COVID treatments. That's going to vary by plan. And again, we don't have the information on which plans would do that, but the plans can choose to do this or not do it. Medicare Advantage plans have to cover out of network and not charge more for COVID-related services. So you can go out of network if you're getting COVID service. So let's say you're traveling and you get sick. You find out that you have COVID, you have to go to the hospital, hospital's not in the network, you're still going to be covered because it's COVID. I talked about the 3-day hospital stay being waived for skilled care. So if you have traditional Medicare, that 3-day hospital stay is waived this year. And once a vaccine is out, it will be covered in full. There will be no copay for Medicare beneficiaries, and there will be no deductible. Getting some of the government statistics. The Hospital Insurance Trust Fund for Part A is said to be solvent up through 2026. This was actually improved by 9 years because of changes that were made to Medicare in the Affordable Care Act. It's also due to the fact that Part A is financed by the employer and the employee taxes. So remember I mentioned we're all paying into Medicare Part A when we're working. So it's financed through us working. Now, what we don't know is if the solvency will be affected at all because of COVID-19 and because of layoffs or people not working. So we don't know how COVID's going to affect this. Part B and D are said to be adequately financed indefinitely because they're paid through the general revenue fund at 75% and monthly premiums charged to beneficiaries at 25%. It is estimated by 2093, parts B and D will actually consume 35% of a person's Social Security check. That's a lot compared to 23% that it consumed in 2019. So we're going to have to get a handle on these costs. Medicare costs were 3.7% of our gross national product in 2018, and that's going to grow to 5.9% in 2038 as all of baby boomers like me enter Medicare. So we have some work to do, folks. The current administration's proposed 2021 budget. Now, this was just proposed. It hasn't gone through. Obviously, nothing's going through, so I don't see it going through no matter if the current administration wins the presidency or not. But what they proposed was a proposed $500 billion cut in Medicare through 2030. Most of these cuts that were proposed were cuts to the reimbursement rate that doctors and other providers get, which I don't particularly see as a good thing. Here in Ohio, most of our doctors here take Medicare. We don't, in some states, that's not the case. I just fear that if they cut reimbursement to providers, doctors are going to be more likely to say we're not going to take Medicare beneficiaries. They're also allowing patients now to see nurse practitioners as their primary caregiver instead of seeing the actual doctor, and they're hoping that that will also cut Medicare costs. They also have proposed Part D reform to lower drug costs and impose out-of-pocket limits for drugs, just like there are for medical expenses in Medicare Advantage plans. So that's what's on the table. I don't know how far it's going to get off the table, but it's on the table now. Legislation, I usually do a session on legislation. We haven't seen any movement in legislation this year. Last year, the House passed Resolution 3, which was an effort to reduce prescription drug costs, but it never got, it was not taken up by the Senate. So all legislation is stalled this election year. And that's all I have. Anybody has any questions, I'd be happy to answer.
Yep, so there is one more question that came in through the chat.
Okay.
Going back to that demonstration plan for the prescriptions, does it limit which type of insulin?
I don't know because we weren't able to see that on the website. I don't think it does though. I think from what I've read, it just says it will cover insulin. Again, if you put what insulin product you take into that Medicare website and do an analysis, you'll be able to see.
Okay.
Okay.
All right. Any other questions that you have? Put them in the chat box, and I will go ahead and read them out. And if not, thank you again for joining us. I will show you quickly before we all jump off how to get to our website, and since somebody specifically asked how to get to that place on the Medicare.gov website to do that drug plan comparison. So give me one moment while I share my screen here. So this is our website, Direction Home websites. And you can get there by going to www.dhad.org. And then to find our Medicare information, you'll go to this Resources and Education tab, and you'll see that when I put my cursor over there, that automatically dropped down with those options. So from Resources and Education, you'll choose Medicare Education. And once you click that, it will take you to our Medicare page, and you'll need to scroll down to get to the information. This top part here just talks about that we're doing these seminars virtually this year and how they work. And everybody who's here with us today is now familiar with Zoom. But again, if you know somebody who would like to join an upcoming session and is a little iffy on it because they're not familiar with Zoom, there is a link here you can click. It's a short YouTube video that walks you through how to connect to Zoom for the first time. Keep scrolling, and we've got our upcoming schedule with links to register. If you would like to watch a second one of these, we encourage that as well. Or if one of your friends or family members would like to do so, you can get to that from here. And then down below are those supplemental materials that we either mailed to your home address or emailed to you. You can get to them here as well. You've got the Medicare frequently asked questions that we typically see. All the Advantage Plan comparison charts for the counties that our Area Agency on Aging does cover. So Portage, Stark, Summit, and Wayne. You've got the Part D, the Medigap, and here's some even more information that is helpful maybe in your choice making. This is a link to the Ohio Senior Health Insurance Information Program that Francine referenced to, another place where you can get that Part D analysis. So that's all here, and this page is also where I will post the link to today's recorded session. So that is all there for you. And then the Medicare.gov site, this is what it looks like. Francine, you see this button here, Find 2021 Health and Drug Plans. When you click that, you'll be taken to this page, and that's where you can learn more about options. Okay, so let's see more chat coming in. Let me make sure they are not questions.
I did see one question. We do not have a website for Carroll County, except for the Medicare website. I also wanted to be clear in looking at the questions I received ahead of time. Somebody asked about explaining standalone dental options for Medicare. If you're on traditional Medicare, you would have to purchase your dental insurance separately. If you choose a Medicare Advantage plan, again, some of those plans do have some dental coverage, so you want to look at that closely. But traditional Medicare in and of itself does not have dental coverage.
And there's another question that came to me privately. It says, I apologize, did I miss Medicare supplemental plans? My husband has an AARP plan.
Medicare supplemental plans go with traditional Medicare. They typically will cover certain out-of-pocket costs. If you have a supplemental plan, be aware that if you drop it, you may not be able to get it back. So if your husband has pre-existing conditions and he drops the plan, Medicare Advantage or supplemental plan does not have to cover him. And if they choose to cover him, they can underwrite him and charge him more. So I hope that answers your question.
Then I see another, do you have to be enrolled to compare? I'm assuming you mean on the Medicare.gov website, and I don't believe you do. I just tried it, and I'm not enrolled. Yeah.
Yeah. You don't have to don't have to have login information for Medicare. You just continue without logging in, and there's a spot that says that. It's pretty easy to use, but as I said, if you don't want to do that yourself, you can have someone else do it for you. And you can call OSHIP or Medicare, and they'll be happy to they will be happy to help you with that. I also want to say that I hope next year we can see each other in person again. I much prefer talking in person than doing this, but it is what it is, folks. And I want to wish everybody a wonderful holiday season.
Yes, thank you, everybody. We appreciate you coming with us into this virtual world. Thank you.
Thank you and have a wonderful day.